Hello, gentlemen, and welcome back. If you are a man over 50, 60, or even older, and you have recently noticed something unusual during intimacy, you reach climax, you feel the pleasure, but little or no fluid comes out, I want you to listen carefully. This can be confusing. It can feel embarrassing. And for many men, it creates a quiet fear they never talk about. You may wonder, is something wrong with me? Is this a sign of aging? Does this mean I'm losing my masculinity? Or even, could this be something serious? I'm Melissa Carter, a medical researcher focused on men's health, aging, hormones, and urinary wellness. And today, I want to explain this issue in a calm, clear, and respectful way. Because the first thing you need to know is this: a dry orgasm does not mean you are broken. It does not mean your intimate life is over, and it does not automatically mean something dangerous is happening. But it is a signal from your body, and like any signal, it deserves attention. Today, we are going to talk about why this can happen, what it may mean, when you should speak to a doctor, and what can often be done about it. Let's start with the basics. In a healthy male body, ejaculation is not controlled by one single organ. It is a coordinated process involving the testicles, the prostate, the seminal vesicles, the bladder, neck, pelvic muscles, nerves, hormones, and the brain. Think of it like a small but very precise system. The testicles produce sperm. The seminal vesicles create much of the fluid. The prostate adds additional fluid that helps protect and transport sperm. Then, during climax, muscles contract and push that fluid forward through the urethra. But here is something many men do not realize. Orgasm and ejaculation are not exactly the same thing. Orgasm is the sensation, the wave of pleasure controlled by your nervous system and brain. Ejaculation is the physical release of fluid. Most of the time, these two happen together, but they are not the same process. That is why a man can feel climax but see little or no semen released. This is often called dry ejaculation or dry orgasm. And while it can be unsettling, the cause is often explainable. Now, before we continue, if this topic is helpful for you, give this video a like and subscribe to the channel. Many men suffer in silence with issues like this, and the more we talk about them openly, the more men get the help they need. Now let's look at the most common reasons this happens. The first major cause is something called retrograde ejaculation. This is one of the most common explanations. Normally, during climax, a small muscular valve near the bladder closes tightly. Its job is to stop semen from going backward into the bladder. When this valve closes properly, the fluid moves forward and out of the body. But if that valve does not close the way it should, semen can travel backward into the bladder instead of coming out. The man still feels orgasm. The pleasure may still be present, but little or no fluid appears. One clue can be cloudy urine after intimacy, because the semen has mixed with urine inside the bladder. This may sound alarming, but in many cases, it is not dangerous. The semen usually leaves the body later when you urinate. So why does this happen? It can happen after prostate surgery or bladder surgery. It can also be connected to diabetes, nerve damage, or certain medications, especially some medicines used for enlarged prostate, blood pressure, or mood-related conditions. This is why it is important not to panic, but also not to ignore it. If the change started after a new medication, after a surgery, or after urinary treatment, that information is very important for your doctor. The second possible cause is a blockage or narrowing in the reproductive pathway. Imagine the body is still producing fluid, but the pathway that carries it is partially blocked. This can happen because of inflammation, scar tissue, past infection, prostate irritation, or, more rarely, small stones or structural changes in the ducts. In this situation, the body may be making semen, but the fluid cannot move normally. Some men notice that the amount of semen slowly decreases over time. Others may feel pressure, discomfort, or mild pain during ejaculation. Some may also have urinary symptoms, pelvic discomfort, or a history of prostatitis. This does not mean you should assume the worst, but it does mean the issue deserves a proper medical evaluation. A urologist may check your history, symptoms, urine, blood work, prostate health, and sometimes imaging if needed. The third important cause is hormonal change, especially low testosterone. Testosterone is not only about desire or muscle, it also supports the normal function of the prostate, seminal vesicles, energy levels, mood, erections, and sexual response. As men age, testosterone can decline. For some men, the decline is mild and natural. For others, it becomes low enough to create symptoms. These may include reduced semen volume, lower libido, weaker erections, fatigue, low motivation, mood changes, increased belly fat, poor sleep, and loss of muscle strength. Many men simply say, "I guess I'm just getting older." But not everything should be blamed on age. If you have dry ejaculation along with fatigue, low desire, weaker erections, and low energy, hormone testing may be worth discussing with your doctor. A simple morning blood test can help evaluate testosterone and related markers. And if there is a true deficiency, treatment may be possible, but it must be done carefully and under medical supervision. Testosterone therapy is not something to start casually or based on online advice. It needs proper testing, prostate monitoring, blood monitoring, and individualized guidance. The fourth cause many men overlook is medication. This is very common. Certain medications can reduce semen volume, affect ejaculation, relax the bladder neck, or interfere with nerve signals. These may include some prostate medications, certain antidepressants, blood pressure medications, and medicines affecting the nervous system. Do not stop any prescribed medication on your own. That can be dangerous. Instead, write down the names of your medications and speak with your doctor. Sometimes the solution is adjusting the dose, changing timing, or switching to another option if medically appropriate. The fifth cause is nerve-related changes. Ejaculation depends heavily on nerve signals. If those signals are interrupted, the process may change. Long-standing diabetes is one of the biggest examples. Over time, high blood sugar can damage small nerves throughout the body, including the nerves involved in bladder and sexual function. Other neurological conditions can also affect ejaculation, including spinal problems, pelvic nerve injury, Parkinson's disease, multiple sclerosis, or previous pelvic surgery. This is why dry ejaculation should be taken more seriously if it appears together with numbness, loss of sensation, bladder control issues, leg weakness, balance problems, or other neurological symptoms. Now let's talk about when this becomes urgent. Most cases of dry ejaculation are not emergencies, but you should seek medical attention promptly if it starts suddenly without a clear reason, or if it comes with any of the following: pain during ejaculation, blood in urine or semen, fever or chills, burning when urinating, new pelvic or testicular pain, loss of genital sensation, difficulty urinating, unexplained weight loss, or a sudden major change in sexual function. These symptoms do not automatically mean cancer or a serious disease, but they are warning signs that should not be ignored. The body is giving you information. Your job is not to panic. Your job is to investigate. Now, let's address the emotional side. For many men, ejaculation is tied to confidence, identity, and masculinity. So when the fluid disappears, even if pleasure remains, it can feel like something has been taken away. Some men become anxious before intimacy. Some avoid their partner. Some feel ashamed. Some secretly worry they are no longer a real man. Gentlemen, please hear this clearly. Your masculinity is not measured by fluid volume. Your worth is not measured by ejaculation, and your ability to experience closeness, pleasure, confidence, and connection does not disappear because your body has changed. This is a health issue, not a character flaw. and the worst thing you can do is suffer silently. If you have a partner, communication matters. You do not need to give a long medical lecture. You can simply say, "I've noticed a change in my body, and I'm going to get it checked." That one sentence can remove a lot of pressure. Now, what should you actually do? Step 1. Notice the pattern. Did this happen once, or is it happening repeatedly? Did it start after surgery? Did it begin after a new medication? Is there pain? Is your urine cloudy afterward? Are you also experiencing erection changes, low desire, or fatigue? These details help your doctor narrow down the cause. Step 2. Review your medications. Make a list of everything you take: prescription drugs, supplements, prostate medication, blood pressure medication, antidepressants, sleep aids, and anything hormonal. Bring that list to your doctor. Step 3. Check your metabolic health. Diabetes, high blood pressure, high cholesterol, obesity, and poor circulation can all affect sexual and urinary function. Men's sexual health is often a window into overall health, so if ejaculation changes, it may also be a good time to check blood sugar, A1C, cholesterol, blood pressure, testosterone, kidney function, and prostate health. Step 4. See a urologist if the issue continues. A urologist can evaluate whether this is retrograde ejaculation, obstruction, prostate-related, medication-related, hormonal, or nerve-related. Sometimes the evaluation is simple. It may involve a medical history, physical exam, urine test after orgasm, blood work, and possibly imaging depending on symptoms. Step 5. Do not self-treat blindly. Many men go online and buy male enhancement pills. Please be careful. Many of these products are unregulated, poorly studied, or may interact with heart medication, blood pressure medication, or diabetes treatment. The correct treatment depends on the cause. If the cause is medication, the solution may be medication adjustment. If the cause is diabetes-related nerve damage, blood sugar control becomes essential. If the cause is low testosterone, hormone evaluation may help. If the cause is obstruction, a urologist may offer targeted treatment. If the cause is retrograde ejaculation, treatment depends on whether fertility is a concern and what triggered it. And that brings up another important point: fertility. For older men, fertility may or may not be a concern. But if you are still trying to have a child, dry ejaculation matters more urgently because sperm may not be leaving the body normally. In cases of retrograde ejaculation, sperm may sometimes be found in urine after orgasm, and fertility specialists may have options. So if fatherhood is still part of your plan, tell your doctor directly. Let's summarize. Dry ejaculation means you reach climax but little or no semen comes out. It can happen because semen goes backward into the bladder, because the pathway is blocked, because hormones are low, because medication is interfering, or because nerve signals have changed. In many cases, it is manageable, but if it is sudden, painful, associated with blood, fever, numbness, urinary trouble, or major changes in your health, get evaluated quickly. Most importantly, do not let shame keep you silent. Your body is not betraying you. It is communicating with you. And when you understand the message, you can take action. Gentlemen, your vitality is not defined by one physical sign. It is defined by your health, your confidence, your relationships, and your willingness to take care of yourself. So if this is happening to you, do not panic, but do not ignore it. Speak with a qualified healthcare professional. Get the right evaluation, and take the next step with confidence. This is Melissa Carter. Thank you for watching, and remember, real strength is not pretending nothing is wrong. Real strength is paying attention and taking care of your health.